The more you sweat in peace, the less you bleed in war. This is war as far as intensive care personnel are concerned. We are demonstrating today the basic donning and doffing procedures for personal protective equipment, and I would urge all intensive care personnel to practice these procedures. By the time your first COVID patients come, you are prepared and ready to follow these protocols so that you can protect yourself against contracting the illness.
The coronavirus, which causes Covid-19, is transmitted through large respiratory droplets and by contact transmission. It is transmitted when infected droplets come in contact with the eye, nose or mouth. Wearing personal protective equipment and maintaining proper hand hygiene is essential to prevent transmission of the virus to healthcare workers. Respiratory protection is carried out using a 3-layer face mask or N95 respirator. Eye protection is done with goggles and face shield. Body protection includes long-sleeved fluid-resistant gown, boot cover and hood, and hands are protected with gloves. The PPE does not require to be sterile. In this video, Kapil and Deepika will take us through the proper steps required for donning the PPE. The PPE will be donned in a location where it is safe to be without PPE. The first step involves engaging the trained observer. A trained observer should supervise donning of PPE. The next step is to visually inspect the PPE for size and damage prior to donning. Check all items of the PPE. Prior to donning, the observer ensures that the individual donning the PPE is adequately hydrated and has used the restroom. Hair should be tied back and all personal items and jewelry are removed. Perform proper hand hygiene prior to start of donning the PPE. Hand hygiene will be performed with soap and water or an alcohol-based hand rub. It is essential to perform all steps of hand hygiene. Wet hands with water and apply enough soap to cover all surfaces. Perform hand hygiene for at least 20 seconds. Then begin donning the protective clothing. Wear the boot covers first. Sit down, make yourself comfortable and wear the boot covers and ensure a snug fit. Next, put on the long-sleeved fluid repellent disposable wraparound gown. Wear the gown and fasten the Velcro strap at the back. Then fasten the tie handed over by the trained observer at the side. The gown should fit properly and should allow unrestricted movement. The trained observer checks again if the gown is worn correctly. Next, don the N95 respirator over the face. Cup the N95 respirator and hold it close to your face over the nose with the straps hanging loose. First, pull the lower strap over the face and pull it over the ears till it rests in the nape of the neck. Then hold the upper strap over the head and let it rest over the ears. Press over the bridge of the nose to create a tight seal. Breathe in and out and check for any leaks from the mask by placing your cupped hands over the mask and under it. Check that the N95 respirator moves in and out with every breath. This ensures that there are no leaks. Wear the hood over the head and let it fall over your shoulders. The trained observer adjusts the elastic over the face to just above the eyebrows and just below the N95 mask. The hood is smoothened over the shoulders to ensure that there are no gaps. Goggles should be compatible with the N95 respirator to ensure a tight fit. The trained observer ensures that no skin over the face is exposed. A visor or face shield may be worn over the goggles for extra protection. Wear gloves over both hands. Ensure that the gloves are pulled tightly over the sleeve of the gown. Unsterile gloves are sufficient for routine care of patients. The final and most vital step is verification of proper donning by the trained observer. The individual takes a 360-degree turn and the observer checks the PPE to ensure proper donning. The process of donning is time-consuming and should be performed deliberately in a calm and patient manner. Only persons who have donned the PPE in a correct manner will enter the patient care area. Remember that there are no compromises when it comes to donning the PPE. The PPE must be donned at all times when entering the patient care areas. After proper donning of the PPE, you are now ready to enter.